Hi, friends. If you've ever felt confused by all the conflicting health advice online, one day coffee's a superfood, the next it's toxic and full of mold. Gluten is the devil, fruit is off the table. This episode is going to bring you so much clarity. Today I'm joined by Dr. Idris Mughal, better known as Dr. Rids. He's a UK medical doctor with a master's in nutritional research, and his superpower is calling out misinformation with hard science, not TikTok trends, not cherry picked data. We're talking peer reviewed studies, systematic reviews, and meta analyses, the gold standard in science. But here's the thing about Dr. Is he's bold, he's unapologetically evidence driven, and he calls out people who share information that isn't grounded in science. And that makes him controversial. And some people really don't like what he says. But what I value from our conversation is how driven he is by his mission to help people and cut through the misinformation. He's not here to be liked, he's here to help. He's also one of the rare few who will actually call himself out when he's gotten it wrong. And in our conversation, we bust some big myths from coffee and gluten to fruit and blood sugar and explore why Dr. Rids believes the rise in gut and bowel disease isn't about emulsifiers or additives like you might have been told. We also talk about cholesterol and cardiovascular health, especially during peri and postmenopause, and what the actual science says. This episode is about helping you stop second guessing every bite you eat and empowering you with clear, credible information. So let's dive in. Dr. Eds, it is great to be with you here today. We're going to definitely bust some myths around nutrition and health. I'm a big fan of your content, so welcome to the show.
Thank you so much for having me. It's a pleasure to be here. Excited to dive into these topics.
What's that, sorry?
Excited to dive into these topics.
Yeah, I'm really excited to dive into many things with you today. I think let's start off because I think a lot of what you do can be perceived as quite controversial for people. You do call people out. For me, what really strikes me as I've been through your content is that the kind of personal mission behind it to really give access to the public to the right information so that they're not confused, they're not spending excess money on things that they might not need to, they're not going down rabbit holes that are not necessarily proven by science. But I'd really like you to just explain why you do what you do.
Yeah, I think there are multiple layers to this. I think it's first important to point out that it wasn't actually my intention to start social media with the main intention to call people out. I think it only really arose from the public's desire and utter confusion around what it is that they're coming across online. So I remember, like, when I first jumped onto TikTok, it's probably 4 or 5 years ago now. I was just putting out little bits of content, simple 3 ways to improve your health, 3 ways to perhaps suppress your appetite, 3 ways to 3 easy habits to install into your life, right? Then all of a sudden, when I got, let's say, 30, 40, 50,000 followers, people started tagging me in other people's content, being like, oh, hey, Dr. Ids, like, what do you think about this, right? And then I would notice, like, as the days go on, more and more people would be asking my opinion on other people's content. So then I decided just to respond to this guy called Rav Malik, who's like kind of some manager of like an MLM, right? Like some fiber sachet, MLM that he has lots of people working for him, and they basically hype up the role of insulin in fat storage and how you can't lose weight if you keep spiking insulin and all this nonsense, right? And then after I did my very, very first response video, it was a perfectly reasonable response video. It wasn't disrespectful. It wasn't rude or anything. People were like, okay, we need more of this, right? Because that is so clear. I've come across that content so often, and now things make sense. And then after that, things just spiraled kind of like almost out of control. It was just every single day I was getting tagged in, 200, 300, 400 videos in a single day sometimes. People asking me, I'm really confused. What do you think about this topic? So I think firstly it's important to mention that it wasn't actually my intention to start calling people out. I only started it because people were asking me to do so. Now, as I, respond to more and more videos, especially viral videos where more of my audience have seen those videos, people are resonating with the responses in a very positive manner by saying, okay, Dr. Ids, you're helping me decipher fact from fiction. All these sensationalized claims, they're affecting my health anxiety. I'm quite gullible. I can't really tell, like, when someone's saying, oh, this food's going to harm you, this food is going to heal all your ailments, like this dietary pattern's fantastic for you, this one's not. So, like, my role now, and as it's just naturally been curated to achieve, is to actually help people understand that if someone's saying massively sensationalized statements, if someone's using, many of the red flags that I talk about, like absolute statements, like fear mongering, like the emotional pull, right, like these kind of marketing strategies to get you to buy into their narrative, the more I can make people become aware of those strategies, then the less they would need to rely on me, right? Because I'm not, I'm only one person. I can't debunk every single flipping health claim out there. But if I give someone the tools to be able to recognize misinformation, which 95% of misinformation, they share common strategies, common communication styles, right? If people can understand those communication styles, then they can decipher what's likely to be reliable or not for themselves. And that's my entire role. Like, I'm not here to debunk every single health claim. I'm just here to get you to recognize what might be misleading and what might be reliable. So that's actually why I do it. And the reason I do it is because, mental health rates are at an all-time high, especially related to eating concerns. There's a paper by Sidani and colleagues that looks at almost 2,000 young teenagers and young adults, especially from America. They found that those who have the highest screen time and screen volume have a over 100% increased risk of eating concerns. Right. So just being on your phone more, just consuming social media content more, puts you at a much greater risk of having eating disorders, eating concerns. We know the rates of eating disorders in the UK are going up. The rate of hospital admissions in the US related to eating disorders have gone up more than double, I think, over a 4-year period from 2018 to 2022. The similar results are happening in Canada, in Australia, in much of the Western world, where we are the biggest consumers of social media content. There are many problems that are arising now from this constant fear mongering, this constant online misinformation. And I'm trying to help mitigate some of these dangerous statistics. Right? People don't realize, but mental health disorders, eating disorders such as anorexia nervosa, an untreated anorexia nervosa patient has like a 20-25% chance of passing away, right? Like, if it's untreated, they have some of the highest mortality rates of any psychiatric conditions known to man. Higher mortality than depression, higher mortality than schizophrenia, higher mortality than anxiety. So, like, these aren't things to kind of joke about or say, oh, it's not a big deal. It's a very, very big deal if you constantly fearmonger, every single thing around you. So yeah, that is basically the reason why I do it.
Yeah, that's what I kind of took for it. Because when I first saw your content, I was like, oh, it feels like calling people out. It felt a little uncomfortable. And then as I started to consume the videos, I could see what you were doing and just showing and actually teaching people how to look at things objectively. And also you're very open about, if you feel that you've looked at something and you've changed your view, then you'll come forward and put that. And I think that's what makes it really refreshingly balanced. I think there's another kind of eating disorder right at the moment around orthorexia, where people become completely preoccupied. And that's where I find your content valuable, because, one of the ways it's valuable, because it can be really, really overwhelming. And I know, as a mum with 3 children, you want to do the best for them, but people have got families. It becomes really expensive. And the point at which you feel that if I put a non-organic blueberry in my mouth, I might damage my brain is a kind of a crazy state, or that I mustn't drink coffee unless it's mold tested, because we didn't have mold testing. And I remember speaking to years ago, speaking to Dr. Megan Rossi about it and the research that came out of King's, and just how beneficial coffee has been shown for health and the polyphenols and things. And in none of these studies were they saying, oh, it was because they drank coffee that had been mold tested and it didn't have mycotoxins and things. It was, I think, regular coffee.
Yes.
So I'd like to go into some of those myths with you first, if we can, because I think it's really important. We've talked about coffee. Let's start there. Do we need to be going and buying ridiculously expensive coffee to avoid mold?
Yeah, no. I think I covered a claim with Dave Asprey actually a while back, where he was on some kind of large podcast and he was like, oh, coffee contains, I think he said, ochratoxin A, and that's it causes cancer in your bladder and it's a gut irritant, and that's why you have to go pee when you drink coffee. And lo and behold, he sells a flipping alternative coffee. It's like, okay, makes sense, right? The fact is, we just have to look at one paper, which is Robin Poole and colleagues in 2017, Poole, if anyone's interested, is a huge, huge umbrella review of over 200, I believe it's 201 meta-analyses of cohort studies, prospective studies, cross-sectional studies. I think there might be a few randomized control trials in there as well, from what I can remember, that looked at loads and loads of different health outcomes. And they found that actually those who drink 3 to 4 cups of coffee a day have the largest reduction in risk of loads of different diseases like type 2 diabetes, liver disease, cardiovascular disease, stroke, heart attack, hypertension. The list just goes on, like on and on and on, several types of cancers. And there was only a adverse effect for there was a small increased risk of a couple of things. I think one of them was fracture risk, especially in pregnancy, so like pregnancy-related fracture risk. And there was one other thing, it might have been Parkinson's or something, but actually the latest data shows that actually coffee might be protective for various neurological issues as well. And it just shows you that the overwhelming majority of evidence, from regular coffee, this isn't some specialist, blend or specialist organic coffees or, tested coffees. This is regular coffee consumed all around the world. Shows that actually the most health promoting properties or the most health promoting effect or protective effect exists in those who drink the most coffee, not the least. So, and there are lots of adjustment models that happen where you kind of adjust for socioeconomic factors, you adjust for lifestyle habits. And of course, we can't deny that those who drink the most coffee probably are wealthier in general. They probably have access to better healthcare in general. They probably have better homes, which, might not have any mold or might not be exposed to different kind of compounds that might be harmful. They probably have more free time. They probably have greater income to spend on wellness, right, and kind of health in general. But we have very, very strong mathematical models that we can employ in research to actually mitigate much of these effects. So when people say, oh, healthy user bias, they're not actually using these terms correctly, right? Because I myself have conducted my own research paper, and it's under peer review at the moment, where I did the statistical analyses myself, looking at kind of diet and depression. And if you understand stats, then you realize that when you make a table of data and you adjust for certain variables within that table, then you almost cancel out the effect that, let's say, your economic kind of situation has, or your physical activity has, and you can adjust for activity, you can adjust for sleep, you can adjust for whatever data sets you have, you can always adjust for them. So, when people say, healthy user bias or people who drink coffee are generally more healthier, it just shows a very superficial understanding of how the research process works. And many of these papers we talk about actually do adjust for many of these variables. So, I don't deny that coffee drinkers have many other aspects to their life which might be health promoting compared to those who don't drink coffee. But the research has been consistent. It's remarkably consistent, even after adjusting for certain variables, that coffee is extremely health promoting. And I'm saying that as someone who doesn't even drink coffee, right? I
I
don't.
love coffee.
Yeah. Many people love coffee, but the point is that I literally don't drink coffee myself, and I can't deny the fact, and I shouldn't lie about the impact that a certain lifestyle habit has for your health, even if I don't engage in it myself. Right? Like, I'm not a vegan myself, but I'm very well aware that having a well balanced vegan diet can be exceptionally healthy for you. Right? I don't like this kind of dogmatic, dichotomous thinking where you have to be in one camp or the other. No, you don't. Even if you don't do something yourself, you can still acknowledge the evidence behind something, right? So that's what I try to do. I try to remain impartial about the things that I talk about.
Yeah. Yeah, I appreciate that. I think the other one that is fairly extreme is around gluten, and then the link with glyphosate, and the kind of talk about the fact that now you're getting a double whammy. That glyphosate itself may loosen the tight junctions of the gut wall, and that gluten does, regardless of. It's almost like everybody's sensitive to gluten,
Yeah.
and then you get this amplification. What would you say around that?
Yeah, I'd say that's nonsense. The funny thing is, glyphosate has been approved yet again by the European Food Safety Authority for another 10 years, I believe. They had a recent review of the evidence behind glyphosate, and I think they looked at, I can't remember now, it must have been over 2,000 research papers on glyphosate, and it's been approved again as a pesticide herbicide. To be used all around the world. It's not just an American thing, for example. The evidence behind leaky gut and all of these kind of pseudo medical conditions that aren't really medical conditions, but they can represent a concoction of different symptoms. There's no strong evidence in humans that glyphosate triggers leaky gut or damages your gut lining. There might be a couple of animal models that could suggest something in extremely high doses, but it's not being shown to any substantial degree in humans. Gluten is in a similar kind of ballpark when it comes to the research. Now, the problem is that you have obviously celiac disease patients, which represent about 1% of the population currently. You have another 1% of people who fall under non-celiac gluten sensitivity, NCGS, which is a very real thing. So they don't have the autoimmune condition celiac disease, but they are sensitive to gluten, and it can cause them certain issues like brain fog, or like difficulty conducting normal tasks, like bloating, like GI distress, for example. But once again, we're talking 1-2% of the entire population. And for those who don't have NCGS, then there is no evidence that gluten is harming your gut lining, is weakening the tight junctions in your gut. I think these claims are massively exaggerated. And you don't develop celiac disease by consuming gluten, right? That's another major big thing. It's like, oh, I've got to keep my kids away from gluten because I don't want them to get celiac disease. That's just not how it works, right? Like, celiac disease is an extremely complicated autoimmune disease, which has very strong genetic penetrance, right? So if you look at the genes, it's like HLA, DQ2 and DQ8. I believe one of them, DQ2 and DQ8, they have a 95% penetrance, and the other one has a 5% penetrance, right? So if you have that genetic predisposition, then there's a high chance that you're going to develop celiac disease in the future, and that can be triggered by certain things. So it can be triggered by a viral infection, for example. Let's say you've gotten the flu, or you've developed a kind of cold, or some kind of viral gastroenteritis, for example. People can develop celiac disease after a viral infection where it primes the immune system to then activate. And there are a bunch of other environmental stressors, life stressors. Let's say a tragic life event happens. Let's say, you've been under chronic stress with your work for a long period of time. Then if you are genetically predisposed, then you can trigger the onset of that celiac disease. But it's not to say that food caused it. It's not to say that, that illness caused it. It could just be the trigger for you beginning your journey of that disease, right? So celiac disease, NCGS, they're extremely complicated processes, and food is not causing them. Gluten's not causing leaky gut. Glyphosate's not causing leaky gut, especially in healthy individuals. So yeah, these claims are massively exaggerated for sure.
So in terms of, I guess one of the things that could be potentially put here is how independent do you trust the regulations that are put in place? Do you think that there's any kind of bias in favor of companies like Roundup? They have big budgets, or do you trust the fact that no, actually the scientific evidence is that it is safe?
Yeah, look, there's kind of industry bias or like industry funding. Yes, I agree, it can be problematic, but the problem is that when there is when there is alignment between industry funded research along with neutral funded research or organization funded research or university funded research or government funded research, when there is alignment across multiple domains and different study designs, then actually it doesn't matter what bias a company has. If all of the data aligns, right, it would be problematic if, let's say, industry funded research is saying, oh, glyphosate is completely safe, let's say x industry is completely safe or whatever, and all of the independently conducted research shows that it's harmful or suggests it's harmful, then I wouldn't even jump to the conclusion that it's harmful. I would say, look, it might be something in the study design. Let's say it's not a guarantee that the scientists are skewing data or making up study results, for example, because there are lots of protocols in place to prevent that kind of thing happening within research. What I would suggest is perhaps we need to look deeper at the methodology of the papers and see whether these scientists have purposefully designed the study to get the results they're looking for, right? There's certain inclusion, exclusion criteria you can look at. There's certain ways that you can design a paper which would make it more likely to obtain the result you're looking for, right? So there is some sort of p-hacking or some sort of skewing of the design or the research methodology that can happen. And I know this because I'm someone that has designed my own kind of analyses, right? But it's very easy for the lay person to just come and say, oh, industry funded research is all bought and paid for, they made up their results. That's not how research works. You can't just make up results, right? Because research is very transparent now, right? Every single paper that gathers any traction will be seen by thousands of scientists. You can't hide it. If it's published in a medical journal, it will be seen by thousands of scientists, right? It will be peer reviewed by many, many different expert researchers in that field. So the way that people can get around that is by purposefully designing the study in a way that makes it more likely that for the data to show a certain outcome. So for example, this is randomly off the top of my head now. If I wanted to show a paper that, let's say I'm the owner of a company that has a better for you creatine, right? A better for you supplement than creatine. Let's say it's a new compound that no one's ever heard of, and I'm making the claim that, creatine is actually not that great. This compound that I've got is perfect, right? I would design a paper where, let's say I'm testing creatine against placebo, and I would design a paper, if I want to design a paper wanting to show that creatine doesn't build muscle, right? I would probably show something that has a very, very short duration, that doesn't even have enough time to build muscle, that probably has a small sample size, that is probably in people that doesn't even resistance train to begin with. So let's say I would use it in, older adults over 65 years old who might be in care homes, who might be bedbound for most of the day, right? And I would design a paper that has that demographic, that doesn't even use a robust resistance training regime. I would probably use a cardio regime, right? That doesn't actually build that much muscle to begin with. And I'd probably give an underdosed amount in my paper. So I'd probably say, why don't we give these people 2 grams of creatine a day? Yeah. Over 6 weeks, not put them on a resistance training program. And then you wonder why, creatine didn't show any improvements in lean mass, right? Now, I haven't made up the data because that's what the data shows. What I've done is I've tried to skew the design of the paper to get it to answer something that I want it to answer. Does that make sense? So it's
Yeah,
like,
absolutely.
I don't want people just thinking, oh, industry funding means that the data's wrong. That's not what I'm saying. What I'm saying is, if there is contradictions between most of the independent studies versus most of the industry funded studies, then we have to look deeper at the methodology. Why is there a disagreement? It's not always a case that some data just pulled out of thin air or made up, because that stuff gets caught out very, very quickly, and that's the end of someone's career, right? If you're a researcher working for a big industry and you just make up data and
It's a career ender,
yeah,
yeah.
that's literally your career ended. Like, no,
But so
researchers
is
don't do that.
badly designing studies, right? I mean, because there's so many eyes on it, that presumably you won't survive that long if you keep kind of trying to skew it to your hypothesis.
Yeah, yeah. You can develop a reputation to, underpower a study, or like, design trials that are just not suitable to answer the question. But that's not a career ender, right? Because you're still producing papers, you're still doing it in a very, you're still doing it in a meticulous manner. You're not fudging data. You're letting the you're letting the data handlers do their job, for example. But you can build a reputation in the scientific community of designing trials to fit a certain bias. Yes, I don't deny that. We see that in the low carb space. We see that in the carnivore space, the keto space, the vegan space. We see it everywhere. But the point is that we shouldn't just equate industry funding with made up data. That's just a very, very superficial way to think about things, right? So
Yeah.
let's circle back to glyphosate and, gut health, for example. When the independent research aligns with the industry research, you have no reason to, be skeptical about the data. The data is the data. And, many of these regulatory bodies, they understand that research bias exists, and they often comment in their reviews that the risk of bias is X. The risk of bias might be high, moderate, low, very low, right? So like, researchers understand that bias exists, but we have to look deeper than just the source of funding. The funding source actually tells you very little about the quality of a paper.
Why do you think then there's such a big drive among like a lot of the functional medicine community in the US to encourage people to completely remove gluten? I mean, it seems helpful from some of what I see in people who have problems with their thyroid, for example. But why do you think there's such a drive for removing gluten from the diet?
I think more than half of my audience are actually American, and I find it fascinating because they're often bombarded with the most weird and wonderful claims, right? I think most of the people I call out actually originate from America, and there's a massive push over there to kind of demonize every mainstream American food product. And there are lots of claims how, the same food in Europe or the same food in Canada or the same food in the UK is just so much cleaner, so much healthier for you. And there's this almost alienation of the American food system where people want to believe that American food products are designed to harm you. They're like specifically designed, they're out to get you, right? And I think this whole kind of conspiratorial narrative that this anti-Western medicine, anti-Western food kind of propaganda that all of these influencers are kind of pushing is just making it more and more likely for someone to believe that, we have to stay away from this cake. The bread that we have over there is not actually considered bread in Europe. It's more like cake, and they add sugars and they add unnecessary amounts of gluten. But in reality, like, I've covered this claim before, and it's largely to do with the different varieties and crop varieties of wheat over there, right? So much of the wheat that the US produces actually stems from hard wheat varieties, right? So you've got the red winter and red spring, hard red spring wheat varieties. Now, on a gram per gram basis, they contain higher amounts of gluten because they're harder wheat, right? And harder wheat shows that it has a higher protein content, and obviously gluten is a protein, therefore you have higher gluten content, right? Now, whereas a lot of the gluten that is produced in many European countries, like Italy, like the UK, like France, for example, we have softer wheat varieties mainly that are produced. And obviously we do import gluten from America as well. And we use them for more harder baking products, less of the fluffy kind of bouncy loaves of breads, more of the harder kind of bagels and the harder kind of baguettes, for example. They use harder wheat varieties. Now, people are conflating that US bread is bad and I develop symptoms in the US. Therefore, there's something else beyond the bread. They probably allude to the glyphosate, like you said, or some guy alluded to the fact that they have folate enriched wheat over there, right, or like flour over there, when actually many countries enrich their flour with folate or like folic acid, for example. So it's a whole mix of reasons like why there's a big push over there to kind of get rid of gluten. It's like not understanding the different wheat varieties. It's pushing this anti-Western medicine, anti-Western food kind of rhetoric. It's the idea that American food is designed to get you ill when it's actually not. It's the idea that European food is just completely kind of superior when it's just factually not. And it's kind of this chemophobia, right? It's this irrational fear of just chemicals in general without actually understanding what the chemical is. So that's why a lot of my content is actually talking about what these chemicals actually are, and realizing that just appealing to nature is just not a very scientific stance, right? Just because something is more natural, just because something is synthetically made, doesn't mean that something is harmful.
Yeah. No, there's plenty of things,
Yeah,
right, that are natural that are harmful. That's the
of
thing.
course. Yeah, plenty.
What have you've done some really good videos on that, which we can
Yeah.
point towards. But when you're looking at unnatural ingredients, where do you come out? Because I think it is a bit of a minefield for people. Now there's, stuff coming out. I think Tim Spector's been talking about gums and things like this that can be harmful. There's a lot of stuff around whether artificial sweeteners are, and some of that seems very extreme. And I guess, what would you say to people listening to this? Are there any things from your research that you're like, actually, do you know what? If it's got this ingredient in it or these three, probably, even if there's ongoing research, maybe minimize how much you're exposing yourself to that. Are there any that kind of stand out for you?
Yeah, well, it's very simple. It's very simple. The things that you should be on the lookout for, which everyone kind of should have enough food literacy to be able to identify these things, are: is it high sodium? Is it high added sugars? And is it high saturated or trans fats? That's it, right? We literally have a classification called HFSS, high fat, sugar, salt. And obviously within the fat category, there's saturated fat and unsaturated fat. Is those three things are literally the only things you need to be looking out for, like for a general health perspective, right? If you cut down things that contain saturated fat, sodium, and added sugars, you are going to make the most that's the biggest lever that we can pull when it comes to reading food labels. I think going into all of these nuances around, emulsifiers and gums and additives, I think it's just such a useless public health kind of recommendation. Because the reason I say that is because, yes, some people, a small minority of people, may be sensitive to a specific gum, or may be sensitive to a specific emulsifier, or may be sensitive to a specific additive. But it's like, okay, in those percent of people, they can just, if they realize that they might develop some gastrointestinal distress from consuming products with that specific additive in, then yeah, just avoid that additive. Like, it's not rocket science. But like, if we're actually wanting to improve public health across the nation, then it's just a useless conversation. Like, these things don't affect your cardiovascular risk to a meaningful extent. They don't affect your metabolic risk. They don't affect your cancer risk, right? Like, I'm talking individual ingredients. Now, don't get me wrong, this is not me advocating for ultra processed foods in general. No. The problem with ultra processed foods in general, is that they are hyper palatable, so they're very easy to eat. They're not very filling. They're typically low in fiber. They're typically low in protein. They're typically high in sodium. They're typically high in fat. They're typically high in added sugars, right? But if we just look at HFSS, high fat, sugar, salt, and we consumed foods that aren't high fat, sugar, salt, then you're gonna that's most of your job done there. You don't need to talk about anything else.
Yeah, you're avoiding a lot of them.
Yeah,
But what do you think then around, like, there's a lot of discussion now around and research going into, we've seen a rise in things like Crohn's and colitis. We've seen a rise
yeah,
in younger people getting bowel cancer, which
yeah,
feels scary.
yeah.
And then people are looking into, is it artificial sweeteners? I haven't seen evidence that it is. And they're looking into these things. What do you think might be driving that increase that we're seeing in bowel issues overall, including cancer, Crohn's, colitis, etc.?
Good question. I think there's a variety of layers here. The first layer is that obviously we have much better diagnostic tools now. We have much more advanced healthcare, right? We have much better tests, much better diagnostic procedures, much better assessments by doctors now that can allow us to identify things earlier and better, right? That's just one of the biggest things people don't often talk about when it comes to, increasing rate in this cancer, increasing rate of this. Yeah, because we can better identify it and earlier, right? Do you really think 50 years ago, when someone comes in with a bleeding ass, right, we were able to diagnose everyone that has the first sign of cancer? Obviously not. Whereas now we have screening prevention programs, we have earlier diagnostic tools. We have the colon cancer screening now, we have prostate cancer screening now, we have breast cancer screening now. We are catching things earlier than we ever have before. So obviously there's a reason why we're diagnosing more things now. It's because our healthcare is just better. Yeah. So that's number one. People that often don't realize that actually better medicine equals more diagnoses of diseases. Right. Number two, I would say that there are a couple of foods or a couple of things in our lives that actually do substantially increase the risk of things like bowel cancer. And one is processed meats, right? So salamis, your sausages, your burgers, your deli meats, your kind of turkey slices, all of these types of processed cured meats. Now, that's for a whole host of reasons. It could be due to the kind of the nitrites within the meats. It could be the heterocyclic amines. It could be the polycyclic hydrocarbons, for example. So there are lots of different carcinogenic compounds that exist within processed meats that have very plausible mechanistic pathways for causing cancer. And the research completely aligns with that. It's something like, for every 50 grams a day, which is actually not a lot, 50 grams is nothing, you have like a 20 to 30% increased risk of colorectal cancer, right? And with unprocessed red meat, there's a similar risk, but it's like per 100 grams, it's like a 17 to 20% increase. So processed meats are the one that are like way, way up there, right? And we also know that, alcohol. So alcohol is very prevalent in Western societies. The younger generation now, there is a trend to reduce alcohol consumption, which is a very, very positive thing. But many kind of middle-aged people, kind of slightly older adults, that generation is still consuming quite lots of alcohol. So there is no surprise that we're seeing more kind of diagnoses of these cancers. When it comes to Crohn's and kind of autoimmune diseases, ulcerative colitis, I think the increase in incidence or the increase in diagnoses is largely down to just better medicine, just better kind of diagnostic procedures, more sensitive tests, more specific tests. I don't think there is strong evidence that any particular food in general is responsible for an increased risk, because you have to remember, these autoimmune diseases, they're not caused by food, right? There are things that happen in our life that can trigger the onset of that disease, but you still need to have the genetic predisposition, right? And there is one other thing. There is the I forgot the actual term here. It might be survivorship bias. I'm not entirely sure. It might be, but anyway, there is a very interesting phenomenon, right? That with improved medicine and improved healthcare, what happens is that, did you know, like 150, 200 years ago, that our infant mortality rate, so the number of infants that before they even reached childhood that would die, was like 40%, 50%. So 1 in 2 babies would die before they reach the age of 5 or the age of 2 in research, right? Now, since medicine has advanced so far, we have got that mortality rate to below 1%, right? It's like well below 1% now. It's like a few in 1,000 babies would pass away before the age of 1. Now, the thing here is that because we can keep practically every single baby alive, despite no matter what illness or what harms or what mutations they might have, despite what kind of genetic predisposition they might have, right? Let's say a baby has, necrotizing enterocolitis, is a very, very fatal infant disease of the gut. The gut basically dies. It basically dies away. We can actually keep those babies alive as well now. Now, I'm not going to say the problem, because it's not a problem, but the issue that arises there is that we can keep every kind of baby alive in most situations, even those who may be genetically predisposed to chronic disease later in life. So when you're keeping every sickly baby alive now, what's going to happen when those babies reach older age? They're obviously going to be diagnosed with more chronic diseases.
Yeah, I mean, that's really interesting. Something actually I hadn't considered. It's very, very interesting.
So
Because
now,
actually what you're saying, also, when you factor in like additional things, right, that we don't know that goes on, they may have a lot of trauma in childhood that then flicks a genetic switch. Like
yeah,
we don't know what they're coping with on top, right, which affects their intestinal tract. It's quite interesting. So they may be weaker in the beginning, and
yes,
then they're exposed environmentally on top. It's
exactly,
kind of
yeah,
like an ideal recipe, right, for things to start to go
yeah.
wrong.
Whereas before, if a baby, let's say, had asthma, or obviously before the age of 5, you can't really diagnose asthma, but let's say it was, childhood related wheeze, right? They would pass away because the first time they would have an asthma attack as a baby, they would just die, right? Let's say a baby gets a chest infection, they would just die, right? A baby has necrotizing enterocolitis, they would just die. If a baby has some kind of esophageal issue, some kind of childhood malignancy, they would just pass away, right? And obviously, those babies don't go on to become statistics. So
Yeah,
now that
it's true. It's
to our own detriment, we're so good at keeping people alive now that
true.
yes, there is a very logical and rational reason why we're seeing an increase in all of these different conditions. It's because we're very good at preventing death, right?
Yeah,
So
you are.
like,
Yeah, you talked as well. I mean, I think even
yeah,
in my own life, right? I think about how many times has there been an intervention? So I had endometriosis. I had an ovarian cyst twisting, right? That required surgery. That's pretty emergency and could be life-threatening. I remember
Absolutely.
when I had my first child. I mean, all three of mine were C-sections, but my first child, we got into trouble, and that ended up being pelvic disproportion. If they hadn't intervened, he could have died, and
Yes.
so could potentially I. And then not long after, actually, my third child, I was hospitalized with double pneumonia. I mean, there was no way out of that. I had viral and bacterial. That was very serious. And you think, actually, I think this is where I feel sad that modern medicine is being so heavily criticized,
Yeah.
because I think we do need to take responsibility for our health and do all of the lifestyle things. And I definitely do those. And we need to have that self accountability and responsibility. But we also need to be super grateful for the times that modern medicine has stepped in, and has a number of times in my life, because I wouldn't be here today, and potentially neither would my son. Do you know what I mean?
Exactly. So, there are always trade-offs to things, right? I'm not suggesting that, oh, modern medicine, everything about it is a positive and there's nothing negative about it. What I'm saying is, once you understand the nuance of why medicine exists, then you can understand the trade-offs, right? So the trade-off is that, yes, if we can prevent someone dying with pneumonia, if we can prevent someone dying with a fractured bone, a pelvic fracture, something, excessive bleeding, childbirth, mother care, for example, antenatal care, postpartum care, right? Postpartum bleeding. If we can be very, very good at treating these things, and we are, then we can't always prevent things that might happen 20 years down the line, or 30 years down the line, because there are trade-offs to everything. So we're fantastic at keeping people alive, but the problem is that once you've been damaged in a very severe way, you're then at a greater risk of things developing later in life. That's just how the body works. The body can
Mm,
only handle so much damage, right? It has to respond in some way. Yeah. So that's not to suggest that we have no control over our health. Of course we do, but there are certain things that lifestyle interventions can affect, and there are certain things that lifestyle interventions can't affect. Right? You can't eat your way out of developing an autoimmune condition. That's just not how it works. You can't eat your way out of never having cancer. You can live the healthiest lifestyle possible, known to man. You can have your own Michelin star chef living in your own house. You can have the best mattress in the world. You can have the best exercise trainer in the flipping world, right? But some people are still going to get cancer. They're
mm,
still going to develop diseases. That's just how the body works. And I have a very um, important lecture on this that I give to medical students. I gave this lecture to Imperial College London students literally a few weeks ago now, and it's called The Role of Food as Medicine. But I have a very important section in there, and it's called What Food Can Do and What Food Can't Do. Because the more we try to sensationalize that food can fix and cure anything, the more we lose people. We have to recognize that food can only affect certain disease outcomes, like type 2 diabetes, like cardiovascular disease, like hypertension, right? Like the risk of fatty liver disease, and just a handful of cancers, right? Not every cancer. Your diet doesn't affect actually the majority of cancers, right? You could argue that diet affects the obesity related cancers. So there are 13 obesity related cancers: endometrial, liver cancer, colorectal cancer, etc., breast cancer. They're all related to your weight in general, and there's an increase and decreased risk based on kind of your weight profile. And as a natural result, obviously, food is related to your weight, and therefore food is related to those cancers, right? But we can't just kid people and suggest that food is the answer to all of your problems, because it's not, right? And I'm
mm.
talking as someone who is a medical doctor but also has a master's in nutrition research, so I'm looking at it from both sides, right? I understand the power that food can have. I understand the power that food can't have. I understand the power that medicine can have. I understand the power that medicine can't have, right? So, like, it's very important we keep our future medical educators grounded,
Yeah.
understand the nuance as to what food can do, what it can't do, and try to refrain them from giving their patients the messaging where they get a false sense of security, a false sense of hope, right? Because we have to make informed decisions. We have to understand the utility of something and when it can be helpful, when it can't be helpful. That's what I call proper informed consent. That's when
It's really
people
important.
can make their own decisions for them once they have the sensible information to hand. If all they're being exposed to is, food can fix everything, food can cure your autism, it can cure your ADHD, it can cure your autoimmune disease, it can cure your cancer, don't listen to anyone telling you it can't cure cancer. If that's all you're being exposed to, then actually you're never getting informed consent. You're never actually getting the information needed to make a decision for yourself. All you're getting is just the pro wellness industry propaganda,
I think,
right?
what I've noticed as well is it can it can put an unreasonable amount of pressure on families and individuals as well. So, for example, I think we're going to post about it at the weekend. There's that study recently that I think didn't have a kind of control group. So it's very early research around the fact of they keep linking, creatine improving brain health or reducing Alzheimer's risk. And this dose in any event was 10 grams a day. And so, as someone like I have a mum with Alzheimer's, so you're constantly thinking, what could I do to improve her situation? But my dad's passed away. So, we also have this situation where I don't think she really wants to be here that much longer without my dad. So, it's like, how many times are we going to intervene? This isn't yet used in the medical space. And so, I think people then feel because they have their family's best interest, I must take that information and now I must go and try that on my relative. But even with that, and I make this point in the post, is my mum has cardiovascular disease as well. She has swelling at the moment in her ankle. I don't know. I would never go and give my mum 10 grams of creatine when I also know that her fluid intake isn't great. Do you know what I mean? And I'm not a medical doctor, so I wouldn't want to interfere with this. And I feel like sometimes there's so much information on social media that it can almost make you feel as a person of, I need to do more. I'm not doing enough. I need to find the information I need to do. And then people are trying things, but they're not necessarily, because they're not medically trained. I'm not a doctor. My background's actually as a lawyer originally before I retrained. I wouldn't go there. Do you know what I mean? I don't have that information and that expertise to try and change things. But I think it's kind of concerning because people experiment, but also I think it again makes people feel bad or like they're not doing enough. They should do more.
Yeah.
Whereas actually, I think we're all doing the best we can. Do you know what I mean? With the
Yeah.
information we have.
Yeah, it's a fantastic point. As you were speaking there, I was just, in my head, it was just like, yeah, what they're doing is they're preying on vulnerable populations, right? And I was just thinking about your situation with your mother there. It's like, she's a vulnerable adult. And, you're in a situation where, you're desperate to find solutions, you're desperate to find something that can help. And that perfectly hits the nail on the head. Cancer patients are vulnerable. Women going through the menopause phase are also vulnerable. Pregnancy and new mothers are vulnerable. And unfortunately, a lot of these vulnerable populations, women are more often the victims of this sort of mentality. And it's like, if you're constantly being fed the narrative that there are solutions in your life and there are pills you can take and there are supplements that you can do, and if you don't do them, you're a bad person. It's like
Yeah,
this subconscious retraining your brain to get you to think that if you're feeding your elderly parent this thing, or if you're feeding your child this thing, then you're the reason they're developing this problem. And it's like this
yeah.
is such this
It
is
is
such a
too much.
fear-mongering, like, wellness narrative. I despise it. I absolutely despise it. And
It
it's
puts
like,
masses of pressure. It does.
yeah,
Like I have a son with on the autism spectrum,
yeah,
and like he actually eats really healthy. He eats a diverse range of foods, but there'd be plenty of practitioners who say to me, "You must remove gluten from his diet." And it's like I don't want. He also has a tendency to OCD. I do not want to cause any extra
yeah,
stress or pressure in my son's life
yeah,
that I don't know is going to absolutely change things for him. Do you know what I mean? Because
yeah,
I think
yeah,
the stress thing's real. Like that's important.
absolutely. The
And yeah, and it's
the,
just
the funny thing you said there, the irony in your situation is that actually the stress could be far more damaging to his symptom
100%.
manifestation and the way he goes about his life compared to anything you change with his diet. Like
Exactly.
the evidence behind any foods having that much of an impact when it comes to the spectrum disorders is actually very, very little. It's very, very little, right? And even if your situation was that his diet's actually not fantastic, even then I would say, well, that you're not doing anything wrong, because the evidence that actually diet plays a massive role in the outward manifestation of those symptoms is very, very small, right? Like, this is all just wellness. It's just all wellness rhetoric. That's not to say you shouldn't try to give your child with, autism, a flipping healthy diet. Obviously you should. But that's not to say that you're causing anything. You haven't caused anything, right?
No.
You're not like, the issue with all these wellness companies and wellness influencers is they really put the onus on the person caring for that individual. And that only leads them to a vicious cycle where it gets them, to become more and more desperate, gets them to become more and more vulnerable. They then buy into they buy into more rhetorics than they would even, know to think about. And then that's when they're using this emotional hook. It's this fear, and it's this fear of not doing enough or being the reason for something bad happening, which I think the wellness industry is very good at profiting off of. And that's
Especially
where,
with women, as you say, right?
of
Because
course,
it's the
yeah,
first thing you do as a mum is you
yeah,
blame yourself. You're like, what could I do? But, the point you make about stress, I really want to highlight, because I think it's so important. Because when you look at something like autism and you look at obviously there's a spectrum, but one of the things that's really apparent to me is this concept around a special interest. And what I've noticed with my son is, if that special interest, and it changes from time to time, is put in a positive framework, he can do incredible things. It becomes a superpower. The moment that special interest becomes in something negative,
yes,
he will obsess over it. And so I don't want to give him anything to obsess over that isn't positive. Do you know what I mean? And so, and I think, like, I don't know, I just feel like we miss a whole piece if we think, as you say, like, it's not all about food. It isn't everything. Like, there's so many things to look at. And I think it's really hard, as with personal experience of it, because you do always think, am I doing enough? But I think we just almost have to take a step back, right? Because, as
yeah,
you say, like, a relaxed environment is as important for a child who has any kind of mental health condition.
absolutely agree. And that's where, there's a reason why the majority of my audience are women, and that's because they're appreciating the kind of the objective, sensible, evidence-based, non-fear-mongering, right, like, reasonable advice that is all based around calming your brain down, understand what the topic is actually about, not getting pulled into these emotional hooks and ploys, right? And realizing what would be a strong lever and what isn't a strong lever, right? It's like that, I didn't ask for most women, for the majority of women to follow me. I'm just putting out, the sensible, impartial advice. And because they've typically been fallen victim to those sorts of messaging, it's almost, what's the word? Like, calming. It's relaxing to come across content that is just calm and reasonable, right? Which is such a strange thing. Like, you would imagine that medical educators should be doing that day in, day out, but actually, many of them do resort to the same fear-mongering rhetoric that I typically call out. And as you know, I call out dozens of doctors myself. I call out
Yeah.
dozens of dietitians myself. I call out dozens of PhD scientists myself, because they're only caring about the clicks and the views. They're not actually caring about how it's impacting someone on an individual psyche, mental health level, right? And even if it takes me 5 times longer to gain the same audience, I don't care. My point is that I want my page to be a safe space, somewhere where they're not going to be feared into doing something, somewhere where they're going to have access to all of the evidence, all of the scientific papers about a certain topic. I always post it over my head on the green screen. I always show the title of the paper I talk about. I never, ever make a health claim without showing evidence to back it up, right? Whereas, how common is it for someone to stand in a supermarket say 10 outrageous things and not have to back up anything they say.
Yeah.
It's
It's a lot
so
of those.
common. And
There's a lot of them.
but like, why is it that people are so quick to believe those guys, but they don't believe what I'm saying? I don't
I think
understand.
because I guess they're buying into a lifestyle that they want. Before you go, because I don't want to obviously take up too much of your time, there's two areas that I'd love you to clear up for people, because you do share so much science. And I think one is that concerns me a little bit, and I know you've spoken about this, is people restrict fruit. I think you've talked about a meta-analysis that shows that when you consume fruit, it reduces your risk of cardiovascular disease. It helps with metabolic health and controlling for body fat and weight loss and things
Yes.
like that. But this sort of wider thing around blood sugar is what I see people is everyone's getting CGMs and
Yep.
everyone's trying to control the spike. So now they're like, I must be in this kind of biohackers type window and never see a spike.
Yes.
And that really restricts their food choices because it's quite difficult to do. And I guess the question I have is, I would see a spike. If I go and have some watermelon, I've tried it with a CGM, I'm going to see a spike.
Yes.
Is that something to worry about? The food matrix of watermelon seems to have so many good things in it.
Yeah.
And where do we kind of draw the line? Is it a case of pairing that with some fats or protein to slow that release? Like, some people say, oh, you don't need to worry about more than just stick within 2 spikes a day. I mean, people were not looking at their spikes before and damaging blood vessels. How much do we need to pay attention to this? I think this is worrying a lot of people.
It does. And, the first thing I would say is the statistics for the US and the UK are pretty similar, but it's something like 10% of adults in the US and UK are meeting the basic recommendations for their fruits and vegetables. Right?
10%.
The basic recommendation. So literally, 2 to 3 handfuls of fruit a day and like 3 to 4 handfuls of veggies a day. Right? Only 10% are even meeting the basic recommendation. So obviously the majority of adults are not consuming fruit in the first place. Right? So like, why are we fear-mongering something that we are so deficient in the first place? It makes absolutely no sense. Secondly, blood sugar spikes. Okay. Now, a spike is a massively subjective term anyway. What substantiates a spike and what substantiates a rise or, a spike? Anyway, I'm sure flipping Jesse, Glucose Goddess, will tell you something different, and someone else will tell you something different. The point is that spikes aren't inherently harmful. Now, that's not to say that we should be consuming added sugars whenever we want. That's not what I'm saying. What I'm saying is foods that are ultra processed and foods that are, minimally processed, like your fruits, like your veggies, like your whole grains, like your dairy. We have different forms of sugar that exist within different food matrices. Okay? If it's sugar that is part of a cake that has lots of saturated fat, that has a bit of salt, that is very poor in micronutrients, that doesn't have any fiber, doesn't have much water in there, is quite hyperpalatable, is low in fiber, low in protein, then obviously I'm not going to say, yeah, don't worry about the sugar, right? Whereas if it's the sugar within an apple or the sugar within a handful of raspberries, they have fiber, they have water, they are very filling, they're low calorie, they have polyphenols, they have flavonols, they have antioxidants, they have they have vitamins, they have minerals. Obviously, you don't have to worry about the sugar in those foods because they are health promoting foods. So this whole blood sugar spike, isolating the effect of a single biomarker, is just such a skewed, narrow view to look at health. Yeah. You have to also remember is that what is some of the best ways to reduce your blood sugar spike? Now, imagine if you tell someone, okay, blood sugar spike is bad, stable, even sugars is good. Okay. Now, what is someone going to do to actually facilitate that change? They can do one of a few things. One, they can cut out all sugar, which means that they'll be depriving their bodies of very healthy whole grains, very healthy fruits, very healthy veggies, very healthy dairy or kind of plant-based dairy alternatives. Yeah. Or two, they can eat things with their carbohydrates that will blunt the sugar spike. Now, what does that? So you've got things like fats. Fats are very, very slow digesting, slow absorbing. Yeah. And what do many of these influencers suggest? Oh, yeah, cook all your food in butter, in coconut oil, in ghee, in tallow. Yeah. So if your method of blunting your blood sugar means that you're drastically increasing the amount of saturated fat you're consuming, then you're only worsening your health. You're not improving it, right? We know from the most robust controlled human trials that saturated fat actually causes insulin resistance. It causes fatty liver disease. It causes cardiovascular disease, right? The impact of saturated fat on blood lipids, on LDL, ApoB, total cholesterol, is completely solid. We've had an evidence base of over 70 years. We have the earliest metabolic ward trials in like the 1950s, right? We have over 400 metabolic ward studies now showing conclusively that saturated fats have a very strong effect on someone's blood lipids, on someone's LDL, total cholesterol, and polyunsaturated fats that are found in seed oils, right? Found in nuts and seeds, all big scary. They have a cholesterol protective effect. They have a cholesterol lowering effect. And the evidence that LDL cholesterol is proportional to cardiovascular disease is irrefutable. All you have to look at is the European Atherosclerosis Society Consensus Panel Statement from 2017 by Brian Ference and colleagues. That's F-E-R-E-N-C-E, et al. 2017, which looked at randomized control trials, prospective cohort studies, Mendelian randomization studies, so genetic studies, that had over 20 million person year follow-up, right? It showed proportionally that as you decrease LDL, or as you increase LDL, the number of cardiovascular events increases in a dose-response relationship, no matter the means of decreasing LDL. So that means it looked at papers that lowered LDL via medication. It looked at papers that lowered LDL via diet. It looked at papers that lowered LDL by genetic predisposition, right? By lifestyle management. No matter the means of lowering LDL, there is a dose-response relationship with lowering cardiovascular events. So that means by default, anything that increases LDL, right? Now, there is some nuance, but let's just say as a general rule, if your dietary pattern increases LDL, then you are causing cardiovascular disease. If a dietary pattern lowers your LDL, then you are protecting against cardiovascular disease, right? I kid you not when I say that the evidence base behind LDL and heart disease is probably the most predictive biomarker we have in all of medicine. All of medicine. There is no stronger blood test that exists that is tied to a chronic disease, a chronic lifestyle disease, stronger than LDL and heart disease. Yeah? All of these cholesterol deniers, they're all just chatting complete nonsense. They don't understand.
So when they say, oh, actually, it's the important thing is whether that LDL is very low density LDL
No.
or LDL, or whether it is oxidized, you don't think any of that matters. LDL is key. Because this is important, actually, because for people listening to this, I've noticed as I'm 49 in perimenopause, right? I've noticed my biomarkers start to change. There's a paper, I think, that's due out in September coming out on the metabolic theory of or the science behind the metabolic changes of menopause. And one of the things you see often is a reduction in HDL and an increase in LDL. So that is actually a real threat. And I think many, many women, right, go on to unfortunately suffer with cardiovascular disease post-menopause. That is a real risk. What is then, so you're saying it is something we need to take account of in addition to ApoB. What's the best way to reduce LDL cholesterol and increase HDL?
Well, so you have to also distinguish between, those who are genetically susceptible. So those who may not be...
Which I am, yeah.
Okay, there you go. Yeah. So I've got family members who are, in their 30s who have a sky high LDL, and it's not because of their diet, right? So, like, so first of all, if you're genetically predisposed and you have certain polymorphisms in genes that mean that you have higher cholesterol, then, I think medication is the only way.
Right.
So, these new ones, these PSCK9 inhibitors, for example, they're very, very powerful drugs. I would reserve those for those who can't improve their cholesterol via lifestyle intervention, for sure. And remember that the lower you get it, the earlier you get it, the better, right? So now, when it comes to lifestyle, there are a few things that are kind of well known to reduce total cholesterol, LDL, ApoB, is that, replacing saturated fats with polyunsaturated fats has a very strong protective effect. So we know, especially from the metabolic ward trials from the 1950s, 60s, 70s, we know that, let's say 1 gram of saturated fat increases LDL by 1, then replacing that with polyunsaturated fat can reduce that by 1. And sometimes the ratio is stronger. So sometimes the protective effect for polyunsaturated fat may be greater than the harmful effect of saturated fat. But the point is the proportion of saturated to polyunsaturated fats we have in the diet is going to be the strongest kind of lever that we can pull. So if you're someone that already consumes a high saturated fat diet, then simply swapping out that butter for a plant-based margarine, for example, or swapping out, your let's say your coconut oil for a sunflower oil, or a olive oil, which is actually more monounsaturated fats, but still better than coconut oil, for example. That's going to be probably the best thing you can do. Also, increasing the fiber. So fiber can actually bind to some of the bile acids that that prevent absorption in the gut, and therefore your liver has to use more cholesterol to then synthesize bile acids, for example. Therefore, you have less in circulation. Also, high calcium foods, having dairy, low fat dairy, for example, or plant-based milks that are fortified with calcium, for example, because we know that they can form calcium soaps in the gut, which then further inhibit the absorption. So the calcium basically forms like a bubble around the fat particles, and that can then prevent the absorption of those saturated fats being absorbed into the bloodstream again.
Interesting.
Yeah, so there are a few
Really interesting.
dietary things that we can do to reduce the impact of saturated fat on our on our cardiovascular system. And as you mentioned with the menopause, the protective effect of estrogen should be well known. And it's unfortunate that estrogen plays a very protective role actually in cholesterol metabolism, cholesterol regulation, and also your bone health, etc., your metabolic health. So especially women going through the menopause phase, we do need to keep a closer eye on our blood lipids. And if you've tried everything possible to lower your blood cholesterol levels, then I think modern medicine exists in those situations.
Yeah.
So remember,
It goes back to how we keep people alive, right? We're very
yeah,
good now at
literally,
doing it. Yeah.
literally, right? Like,
Yeah.
especially the newer generation meds we have now are very, very strong. Even in those who have familial hypercholesterolemia, which is a genetic predisposition to high cholesterol, we see that these medications can reduce their blood lipids by like 60% or something crazy, right? Whereas diet can't reduce it at all because they're genetically predisposed. So
So
don't
when
be
medication
afraid.
is necessary.
Yeah. So like, don't be afraid to use medicine. It exists for a very, very powerful reason. But obviously know that we do have certain things we can do to try and mitigate that risk. But just one thing I just want to finish on is just don't buy into these people claiming that you need to have a high cholesterol level to be healthy. It's just absolutely the stupidest thing. I think it's probably the most dangerous, wellness fad I've come across in recent years. The idea that LDL is not harmful. Don't worry if you have sky high LDL. If your HbA1c is fine, if your CRP is fine, if your body weight is fine. No, you're literally killing people. They just don't know it yet, right? Like, just don't buy into the narrative. And we know that it's being pushed by these pro-animal-based, pro-carnivore influencers because they have to push it. Do you know why? Because the biggest change that they get in their blood markers is their cholesterol levels. So if they can't explain the reason for that happening in a positive way, then obviously no one's going to follow their diet. So why is it that the one major negative that is experienced from their diet, it has to be a myth? That's very interesting, isn't it? It's like the blood marker that happens to go through the roof on a carnivore diet happens to all be a myth. It happens to be just, no, don't worry, this is actually healthy for you. Yeah? Whereas before this trend, no one was saying that. No one was saying high LDL is not a problem, right? No one was saying, like, it's just so interesting. Out of all of the blood markers, why are you picking on the one that has been documented to increase on that diet? You know, I want the audience to go away thinking about that.
It's also concerning how much fiber and polyphenols and antioxidants and all these other things are removed from the diet when you follow that dietary pattern. Yeah. What would you say? I've had this come up actually with people. This is another trend in peri and postmenopause. Is you might actually have a full set of bloods done where your fasting insulin looks good, right? And that's not always done on the NHS, but when someone's paid, but they're beginning to see their HbA1c trend up. That's when I see people go, whoa, I better move into, I'm going to correct this pattern with keto or carnivore because I need to go the other way. What would you say to someone in that situation?
Yes, unneeded, completely. There's a systematic review in 2022. I want to say it's by DeVries, Devreis, and colleagues in 2022, which looked at, I believe, 60 randomized control trials on high to moderate carbohydrate consumption diets compared with low carbohydrate diets and the impact on type 2 diabetes outcomes. And it shows that actually the diets that were up to 65 or 60% carbohydrates, they had the same rates of improvement in type 2 diabetes as the extremely low carbohydrate diets. And this was up to 2 years in duration. These aren't short-term studies, right? Following a dietary intervention for 2 years is no joke. Yeah. And the point is that type 2 diabetes is not caused by carbohydrates. That's just a fatal misunderstanding of the disease process. What has to happen is you have to become, you don't have to, but in most cases, you become insulin resistant first. Yeah. And the way you become insulin resistant largely is a combination of excess adipose tissue, so gaining fat, inactivity, so you're not moving your body as much, yeah, and then a couple of things that we know worsen insulin sensitivity on a gram per gram basis. That is saturated fats, not having enough polyunsaturated fats, and what else is there? And alcohol, right? So we know that these things uniquely worsen insulin sensitivity, as well as poor sleep quality, stress, heightened levels of stress, etc. But once you become insulin resistant, let's say from becoming obese, for example, then it doesn't matter what type of diet you're following. You're insulin resistant. Yeah? The way you prevent that from becoming type 2 diabetes is by losing that excess adipose tissue, is by moving your body and working on your sleep and stress. That's how you improve it. So that's why the controlled trials that compare high carbohydrate to low carbohydrate diets, they show equal improvements in type 2 diabetes, right?
And this is like food-based, whole food carbohydrates.
Yeah. Oh, yeah, of course. Yeah.
We see that in the longevity studies, right? Is that I think it's like 55% carbs is correlated with longer longevity. But yet people are conditioned, I must go low carb, I must go down this road.
Yeah, don't get me wrong. You can devise a very healthy low carb diet if you wanted to, right? But that's not the one being touted online, right? let's say an example of a very healthy low carb diet is something that includes lots of fibrous veggies that have low carbohydrates, is one that contains unsaturated fats from olive oil, nuts, and seeds, right? Fatty fish, legumes, lentils, beans, chickpeas, tofu, whatever, seitan, and one that contains a little red meat, lots of lean protein, and is low in saturated fats. Yeah, you can devise a healthy low carb diet, but that's not the diet being promoted. The diet being promoted is a low carb, low fiber, high saturated fat diet. That's where the problem lies. So like, you don't need to go low carb. Low carb can work if done correctly, but it's like, if you love your carbohydrates, then just have more whole grains, have more fiber, have more fruits and veggies, right? You don't need to avoid carbohydrates, and there's little reason to avoid whole grains in general anyway. All of the data on whole grains and long-term health outcomes show that it's just overwhelmingly positive for health.
Positive.
So anyway, I could talk about that for hours. Yeah.
So just to finalize the question on the glucose then, and then I'm going to ask you to link so people can find out more about everything you do. If someone's having some fruit, they see a spike, it's a whole food based, you wouldn't be worried about that. So this theory around spikes cause blood vessel damage, that's not a substantiated worry.
Well, so what people like the glucose goddess are not telling you is that blood sugar does damage vessel health, yes, but not in the short term. If you have chronically elevated blood sugar, then absolutely you're going to cause damage to all of your organs, because that's why type 2 diabetes is so deadly. And that's why you damage all your vessels, and that's why you damage your nerves. That's why you lose feeling in your toes. That's why your kidney health worsens. That's why your eyes, you can get diabetic retinopathy. You start to go blind, for example. That's why you get strokes, because the chronically elevated blood sugar is damaging your organs. Yeah. But the transient peaks and troughs are not a concern if you don't have insulin resistance and you're not type 2 diabetic. Yeah. The reason why the spikes are problematic in type 2 diabetes is because the insulin can't function properly. So if you don't have properly functioning insulin and you are insulin resistant, then I would say it's probably not wise to just have, a bowl of watermelon 3 times a day spread out through the day. Yeah, obviously I'm not saying that's sensible. But what I'm saying is, if you're a normal person, okay, let's say not normal, if you don't have type 2 diabetes, then transient peaks and troughs where your body is able to regulate your blood sugar effectively is not a problem. There are high carb foods that are very health promoting. Don't be scared of them. Whole grains.
Should I tell you a funny story before you go? Funny story. So I could follow the glucose goddess's advice, right, on this, is go with the fiber first, right? Then you're going to eat the protein, and then you have the carbohydrates. And then if you still want dessert, you can have dessert. So I happened to be wearing a CGM a few years back on one of my birthdays. And my kids, being young at the time, had made this Kit Kat cake. I mean, this is like literally a heart attack in a cake. Yeah, it had so much saturated fat, so much sugar. We'd had steak, I'd had broccoli, so I'd had the veggies first and everything. I was wearing the CGM. I had a very small bit of this. So what happens? I didn't see the spike, but what did happen is that my blood sugar was still within range, but elevated above 6 all night. And I'm pretty sure that had you taken my blood, so would my lipids have been elevated all night, right?
Yes.
Which is actually not a healthy situation at all. But what I had done was master the no spike. Do you know what I mean? And it wasn't close to healthy.
Yeah, this is why in research we look at area under the curve, right? So you have insulin area under the curve and you have glucose area under the curve. So in research, it's AUC. So when you look at research on blood sugar and how it relates to health, typically researchers will look at area under the curve. So it's not about how high the spike goes. It's about what is the total amount of blood sugar underneath the line, right? And even if it's slightly elevated, but it's remained elevated for a longer period of time, but it's not considered a spike, that's arguably a lot more damaging than having a massive spike and it coming down straight away.
Yeah.
So these are the nuances that these people are not understanding, because they're not researchers, they're not metabolic experts, they're not doctors, etc. So, like, yeah, the blood sugar spike thing is nonsense. Don't be scared of it. Chronically elevated blood sugar is a major problem. If you don't have insulin resistance, then don't worry about transient peaks and troughs. It's just completely just stupid to think about.
Amazing. Thank you so much, Dr. Id. I know you've been here. You've been really generous with your time. Been spent a
No,
bit
thank
longer.
you.
It's been really helpful, really fun. I think people are going to get so much value out of this. I know that you share loads of content on your Instagram. That's where I see it. You also have courses. You have a membership that I think really helps people, where you distill the science every single month. Please share. How can people connect with you, learn from you?
Yeah,
Please
I
share.
think yeah, guys, I'm on TikTok, Instagram, and Facebook. So TikTok's my biggest platform, Instagram, and then Facebook. It's Dr_Id, so Dr_IDZ. If you're interested, I've done kind of a book called Saturated Facts, where basically it's debunking a lot of the things that we talk about today. Especially, and also I cover the industry funded versus non-industry funded research as well, which I think is very crucial that not many people are discussing. So feel free, that's 2 years of my work there, all put into one book. And then also I have a higher level kind of research breakdown course that you alluded to. So it's called the School of Dr. Ids. So yeah, feel free to watch my content and sign up to anything that you would like. And I'll continue making the videos free for you guys to watch. So yeah, hope it helps.
Amazing. Thank you so much. Thanks for coming on the show.
Thanks for your time.